This is episode 32 of Hands on Health, the podcast all about living your healthiest life on the coast. I'm your host, Felicia Struve. My guest today is cardiologist Dr. Rinkevich. Dr. Rinkevich is the medical director of the CMH OHSU Cardiology Clinic. She's also the director of the OHSU Heart Disease in Women program and an associate professor of medicine at OHSU. We're talking about how COVID-19 affects your heart health and how the COVID-19 vaccine might affect you. Welcome, and thanks for joining me for another episode of Hands on Health. Welcome, Dr. Rinkevich.
Thank you. Thank you for having me.
So what types of concerns have you heard about the COVID-19 vaccine?
I think that is an excellent question to start our discussion because indeed I have heard so many concerns from my patients. Many of them very valid points. Others are a little bit more questionable, coming from social media. But for the really valid point, like, for example, do we have data about the long-term side effect of this vaccine? Or can I be vaccinated despite the fact that I am taking a bunch of medications already? Or, for example, what is my risk if I get the vaccine to get severe side effects like a stroke or a heart attack? The main concerns, I will say that actually is true. We do not have data about long-term side effects regarding this vaccine, but I should mention that this is not a new technique. When we talk about the available vaccines in the United States, two of them are messenger RNA vaccines, like the Pfizer and Moderna. Despite the fact that they are now used for the first time in the United States, this investigation of these kind of vaccines for coronaviruses has been going on for a long time. So we do have significant data about the side effects that can happen lately, let's say in animals. And so far, nothing has been shown to be of concern. For people that think that this kind of a thing can make a genetic disarray or, bring long-term side effects, we know already that all those things never happen, not only in the animal data, but also in the first volunteers that got the vaccine actually like a year ago, because the first people that were vaccinated, the volunteers, got these vaccines about a year ago. Furthermore, we know that they continue to follow up very closely all these volunteers. And so far, we don't have any signal regarding any concerning side effects for the long run.
So in short, people who are getting vaccines right now are not the guinea pigs. All that testing, it's all been done, proven safe.
Absolutely. They are not the guinea pigs. This is very true. We have a lot of data already, and when we talk about the emergency approval of a vaccine, it's not because we don't know anything about it in the long run. In fact, recent data published showed that, as I mentioned, these kind of vaccines have been going on for a while for things like Ebola and other diseases also. And this is why it could be developed so fast. It's amazing that at the moment that the Chinese scientific group published the genetic codes for this virus, immediately the labs could start to work on it because they already had a lot of information about how to develop a vaccine using messenger RNA. So we are not the guinea pigs. This technique has been running for a long time, and fortunately, the scientific community has been working for other diseases for so long in this kind of vaccines that they were ready to go at the moment that they got the information that they needed to produce the vaccine specific for this virus.
So you mentioned that people are coming in with concerns, and some of them are based on basically what they're hearing on social media. What is your recommendation to those folks?
I will definitely recommend them to get their data from scientific resources like the CDC the Oregon Health Authority, in our case here in Oregon, a university program that constantly are updating data about COVID-19 and the vaccines and so far and so on. If they still have some doubts or questions, they should go to their primary care provider or any provider. I will tell you, Felicia, that recently I have been checking each one of my patients if they did have the vaccine or not. And if for any reason they didn't have the vaccine, I specifically asked them, what are your concerns? And then try to address specifically the concerns of the patients. So I think that it's very important. I do understand that people are nervous and reluctant, but the best source of information will always will be either way, scientific information or a provider that you trust.
Mm-hmm. And from what I've read, people are trusting their doctors more than any other source on.
I agree. And in fact, I feel that I have convinced most of my reluctant patients to get the vaccine after answering their concerns. I think that definitely people have valid concerns, especially my patients which are baseline having cardiac problems and they are afraid sometimes to get the vaccine, thinking that they may have significant side effects that can worsen their health.
Well, are there people who are too sick to get the vaccine?
No, actually, the sick you are, the larger your benefit. Remember that this disease is especially have a malignant response, especially in sick people with pre-existing conditions like diabetes, hypertension, cardiovascular disease, and so far and so on. So it's important that actually those people will get vaccinated. The sicker you are, the larger the benefit that you get from the vaccine.
Mm-hmm. And are there medications that people might be on that they should be careful about getting the vaccine, or is it pretty much you're good to go?
Excellent questions. So far, there are not reports of any interaction between any medication and the vaccines that have been approved in the United States. Having said that, the only contraindication or relative contraindication until you learn more with your primary care provider is if you have any severe side effects from previous vaccines like the influenza, the flu vaccine. In those cases, if you have severe allergic reaction, you need to discuss this with your primary care provider and put together, risks and benefits and decide together what will be the best action. But other than previous severe allergic reaction or having been sick with COVID-19 less than 2 weeks before the vaccination or having a previous vaccination in the previous 2 weeks, they would be the only contraindications that I am aware of.
And in those cases, if you'd been sick with COVID-19 or if you'd had a vaccine recently within the last 2 weeks, it's not a reason not to get it. It's just a reason to wait, correct?
Exactly.
Okay.
And this is very important, what you just mentioned. If you got the COVID disease, you still need to get vaccinated.
Mm-hmm.
You don't build up a strong immune response not to get the disease again, as you will if you get the vaccine.
Yeah. Well, and part of that's like teaching your immune system too to recognize it. So you would think if you've had COVID-19 and then you get vaccinated, you're just giving your immune system more information to be able to catch it faster the next time that it's exposed.
Yes, absolutely.
So what sort of impact does COVID-19 have on the heart and circulatory system?
So the COVID virus, which is known as coronavirus 2 or SARS-CoV-2, is actually a virus that mainly provokes disease on the lungs, but can provoke a significant inflammatory response and provoke multi-organ failure. Not only the lungs, but also the heart and even the kidneys and so on. So the heart can be affected in different pathways, and we don't really know why some people get such a severe disease with significant inflammatory response, where other people have a minimal disease or no disease at all. But for those that have severe disease, it probably related to this significant systemic inflammatory response that in the same way that attack the lungs may attack the heart. Sometimes it's just the virus hurting your heart muscle. Sometimes it's through the immune response. Sometimes it's through the same kind of enzymes that get knocked out because of the virus, which are necessary for the normal function of the lungs. And they are sharing some of these enzymes also in the heart and other organs. So when these enzymes get knocked out, then a patient can develop, for example, heart failure. Sometimes has to do with a more increase of your coagulation system in a abnormal way, so you can get a clot in one of your heart vessels and develop a heart attack. So, as mentioned, there are different pathways to get disease of the heart, from attacking directly, the virus attacking directly the heart muscle, through the fact that you can form a clot in your heart vessel and have a heart attack, and in between all these possibilities.
Yeah, it seems like there's so many different ways that it can cause you a
it's
problem.
a very strange virus, I will say. Sometimes, people don't even know that they have it. Mm-hmm. And sometimes people do severe disease. But data is data. And we see that people that get more complications from the heart are the ones that get severe disease on the lungs. So there is a common pathway.
Okay. So that's also part of that multi-organ failure issue.
Correct.
When people are severely ill. So heart, lungs, everything else in between, I suppose. So are these types of really severe problems, are they more likely in certain groups?
Yes. Once again, the people that have cardiovascular disease and other conditions like diabetes, importantly, obese people have much higher risk of have severe disease too. Those are having more severe disease than the general population with not pre-existing conditions. Having said that, we'll read of more and more reports of younger people without apparent severe diseases that got severe complications from the infection from COVID-19. But definitely, the disease is much more aggressive in people with preconditions, especially cardiovascular conditions.
And you had mentioned inflammation being kind of a key issue around how COVID-19 is impacting the body. And it seems like that's also tied into some of these groups that are more likely to have problems. Their inflammation is one of the root causes of some of these chronic diseases as well.
Correct. So correct. That's a very good point, Felicia. Good for you.
I'm connecting dots.
Absolutely. We know that, for example, people with diabetes have an inflammatory system working not as well as we wish. So we measure sometimes even some markers of inflammation in the body, and we noted that some of these patients with rheumatic disease, diabetes, and so far and so on have a baseline high inflammatory state, which can be aggravated by this virus.
So there's certainly some lifestyle things that we can do to lower our general inflammation levels. And those fall in those heart healthy exercise, good nutrition, losing a little bit of weight if you're overweight.
Absolutely. That this is very close to my heart.
Yes.
I always want to use the opportunity to talk about the lifestyle modification. It's important, regardless of this COVID-19, that just one more time show us how important it is to keep a healthy lifestyle. So to have less risk for a viral infection. But as you mentioned, regardless of this virus, it's important that we really take care of ourselves by keeping a healthy diet, regular exercise, healthy weight. Those are so important to our health.
Hey there, it's Felicia. Thanks for listening. I'd love to include your questions or comments in an upcoming episode. To leave me a message, please call 503-338-4654. If you've got a health question, I'll do my best to get you an expert answer. Again, that number is 503-338-4654. Now let's get back to our guest. Can I put you on the spot? You are a mother of 3, and you are also a very accomplished physician. So you juggled a lot. And you continue to. I mean, you have multiple positions in your current professional life. How do you take care of yourself in that? What are the key things for you?
I will start with that. I work very long hours. Sometimes I go home at 9 p.m.
Mm-hmm.
So I made a routine in my life that I wake up 40 minutes earlier of whatever time I need to wake up, which is pretty early in the morning. And I do exercise for 40 minutes during the week time. And in the weekends, if I am not on call, or even if I am on call in between, my husband and I like to go for hikes. So we hike, every weekend, at least for 5 to 6 miles. We both keep a healthy weight. In life, it's everything in moderation. It's not that I am very strict with my diet, but I try, to spoil myself only on the weekends, and during the week, try to eat pretty healthy, based on fruits, vegetables, fibers, fish, and try to keep a very healthy weight in that regard. I personally don't like to eat during the day when I am seeing patients, and this is, a personal decision, because when I eat, I feel a little bit more tired, and I want to be to my best when I am seeing patients. So I wait to eat until the clinic is over. But even if I don't do that, I know that for many people it's difficult not to eat for many hours. I will say, choose your snacks. Try to bring, even if you are at work, try to bring to work, an orange or an apple. So if you all of a sudden get hungry, you have a healthy snack to choose. And this is the only body that is assigned to us. We need to take good care of it. Mm-hmm.
I think you've really hit on some great tips there. And the one even for people who are pretty active and they're eating healthier meals, it's that snacking thing that really is difficult for a lot of us. So yeah, planning for that.
You need to plan ahead always to have a healthy snack with you rather than grab some.
And you prioritize activity.
Yes. Mm-hmm. And I would say that activity is essential.
Mm-hmm.
I mentioned that I wake up early in the morning because I get it. By the evening, it's not like you or the rest of the humanity. We are all extremely tired after a busy day. Sometimes I say I need a rest, not only for my body, but also for my brain, just relax after a heavy day at work. So because I know that when I go home, I am too tired and I will find any excuse not to exercise, I just start my day. And by the way, I noticed when I started with this routine, I noticed that I feel more energetic in the morning because, as you know, when you exercise, your level of endorphin go up. By the way, these are good, enzymes that actually decrease your inflammatory state, going back to the inflammation.
Yeah.
So exercise is an excellent way to start your day, because then you feel more energetic through the day. By the evening, I am really tired, and I'm sure that if I was postponing that for the evenings, I probably will never be exercising.
Well, isn't it amazing how much work your brain will do to keep you from exercising in the evening? All those excuses. Well, for the people who are young, they consider themselves to be low risk. Why do they need to get vaccinated too?
So the continuous viral shedding in the asymptomatic or pre-symptomatic individual, like it would be a young person that just contract the virus and may not even know that is carrying the virus, may have no symptoms at all or minimal symptoms, the virus will continue to spread. And they are putting at risk all the people that are surround them, from coworkers, family members, grandparents even. So it's important that the young population recognize that, it's part of their civic duty, I will say, to get vaccinated to protect the vulnerable population. So I always tell the young people, if you don't get vaccinated because you think that you're healthy and you are not afraid of the virus, first of all, they should know that here and there, this virus can be very aggressive, even in the young people.
Mm-hmm.
But even if they feel Superman or Supergirl, and they feel that they may not have a severe disease, I always emphasize the fact that they can be transmitting the disease that can be devastating, with devastating consequences for the vulnerable population.
Well, I recently had a child whose immune system kind of went over the top after a virus and caused other problems. And that's in some ways similar to some of the complications that can come from COVID, the cytokine storm situation where the immune
Right.
system actually attacks the body. And that's a young, healthy immune system that's just going like in hyperdrive. So that can be any of those, mountain bike riding vegan 24-year-olds out there.
Absolutely. And you have heard and read reports of very healthy young people that have very severe disease. We still don't have a good reason to understand why sometimes the disease can be so dramatic. One of the theories is actually related to probably the amount of virus that you were exposed to. Let's say that you have a massive amount, and this is why young doctors and young nurses, got severe disease, and few even die without having chronic condition at the beginning of the disease when we were not even aware of it. Especially the frontline workers, especially physicians and nurses and MAs and so forth and so on, got so many patients with the disease that probably got exposed to an enormous amount of viruses at once, and may have been the reason why all of a sudden they develop severe disease. And I should say another thing for those people that are reluctant to be vaccinated, if I can. So this virus, like all viruses, are constantly mutating to survive. Because if you attack them with a medication or a vaccine or whatever it will be, they still want to survive and they mutate, but they cannot mutate in other places but the human being. So if you have been vaccinated, you are cutting the cycle of mutation, and we can sooner get rid of this virus. So it's important to consider that too when you may say, no, I'm too young, and I live by myself, I don't see anybody, I will not infect anybody. You still are a source of possible mutation for the virus.
So you don't want to be patient zero for the next deadly variant that comes up.
Absolutely.
Well, thank you so much for helping us to understand how COVID is affecting the heart and why it's so important that we get vaccinated, and the fact that very few of us can't get vaccinated.
It's exactly right. And in a way, we are protecting the very few of us that cannot be vaccinated.
Mm-hmm.
You know, if we all get vaccinated, we are protecting even this small group that cannot be vaccinated for whatever reason it will be, which is an extremely small group again. But we want to protect them too.
Well, and until the vaccine is tested and approved for younger children, there's still quite a number of people in our population who just simply can't get vaccinated yet and are still vulnerable.
Absolutely. Excellent point. We are still protecting our children too.
Yeah.
That cannot be vaccinated. Mm-hmm. And I would like to finish this conversation again by reminding everybody that if they have any questions or concerns, they should talk with a health provider that they can trust to try to answer all their concerns in a one-on-one conversation. Because again, many of the questions are very valid, and I think that it's fair to say that people need more information to understand why they should get vaccinated.
Yeah. And you have nothing personally to gain from telling somebody to get vaccinated, whereas the Facebook source does, because they're getting money for your eyes, for your clicks.
Correct. A good point.
So,
I never
coming
saw
from
that.
a marketing standpoint, like, you're not making any money on this. They are. So, yeah. Well, thank you.
Thank you so much, Felicia.
Thank you for joining us today. I'm Felicia Struve, and this has been an episode of Hands on Health, brought to you by Columbia Memorial Hospital in Astoria, Oregon. CMH is an independent, not-for-profit health system that provides comprehensive, person-centered care in Northwest Oregon.